Hello everybody, welcome back to my channel again. As we approach to the 5-year anniversary on my YouTube channel, I want to begin to dive into something more complicated, more realistic approach mental health technique for you guys to use. And today we really want to talk about something and some content that we can make a mistake on our daily life. Even for the clinician itself, when they start practice those care with their client, they can make a lot of error due to not really focus or making a lot of mistake on not focusing on manage understanding those error concept when they were giving out the treatment. So the first thing I want to talk about is effort justification. So for this type of error, it's always involved with the client. The client kind of invests so many time, a lot of time with you. As a clinician, you provide a lot of support. And in some illusion, they may have a psychological belief that because they make a commitment, so there should be some sort of reward, some sort of improvement. And yes, there should be some kind of improvement, but sometimes it's not that clear when they go through that treatment, especially with multiple anxiety, phobia, things that they go through, even with psychotherapy. So it's called effort justification because they believe they put the effort in and they should get a certain reward and with the feedback, but sometimes that's not the case. And the other one I want to talk about today is called the illusion of control. So the illusion of control involved with, as a clinician, we think when we're looking at a different example with a lot of action that we make for our client, and we feel like sometimes one stone fitting into the whole pocket. We have this misleading of sense of belief that somehow if we have measured the control over our treatment plan and the client will improve. But sometimes we develop a lot of error in the perception because sometimes the client's action are their own responsibility. And if we didn't generalizing those kind of error, we may believe that we have the control of the treatment, but sometimes it's not the case. And the last thing I want to talk about during today's YouTube is called Naive Realism. So this is pretty straightforward. It's talking about as a clinician, we have this error belief that we can always trust the data or whatever the past treatment effort, and we think this is what we see, this is what we believe, and this is what I saw in my own eye. But sometimes seeing may not is believing, even though there's a word like this, seeing is believing. So a lot of data may not necessarily be a accurate prediction of our client's change and client success. So you have to kind of go through a lot of a process in order to understand how you can support your client. So that's for today's YouTube. If you have any question, concern, you can leave any comment down below on my YouTube channel, and I will see you again at the next video.